how do you handle conflicts in a medical setting? How do you handle conflicts in your medical workplace, with your colleagues, perhaps, right? So this is a very common question, and they can ask in numerous ways. But if you just understand the principles, again, are going to be professionalism, responsibility, and ethical behavior, and upholding the ethical standards of the profession. You take these three in all of your situational questions and ethical questions, then you are fine. Okay, you just have to make sure your answer is ethical, your answer is professional, and then you will be perfectly all right. And responsibility is the main pillar of this as well. So ethical, responsible, and professional with any of this. All right. So how do you handle conflicts? Noor, do you want to give an answer first, just to see what was your approach? What do you think? I don't want to put you on the spot, but it's up to you. I'm not sure if she's still here. No, I think she's on mute, so it's okay. Let me just go over this answer. All right, so, all right, good question. And I do believe that in a high pressure, high stress environment such as medicine, conflicts can definitely happen, particularly when there is some misunderstanding. And I do realize the most issues happen due to communication issues. And my approach has always been that I believe that resolving conflict is through open communication and collaboration. And there was a busy shift that I remember during my final year of medical school. And we were actually in the ER, and the patients were not being distributed appropriately, at least to myself. And I got fairly upset because I felt that my fellow final year medical student, was not taking as many patients as they were giving me. And I personally got a little upset because I was overloaded with my own patients. But I thought about it. I said, let me try to figure this out, and let me try to communicate it in an open manner. And I mentioned that, okay, I see that you only have 5 patients, and I got around 8 patients already. My resident was nice enough to talk to me that, hey, I see you have a few more patients, but I have a few more sicker patients. And I realized at that point that I definitely need to step back a little, and that colleague of mine is actually under more stress, or equal stress, based on the acuity of the patient that we are handling. So rather than I let the situation escalate, or I complain in a improper manner, I took the moment to pause and asked how we can quickly resolve or understand this issue better. I looked to explain my situation, and I waited for the other person to communicate back to me. And because of this, my own apprehensions were resolved. So whenever there is a conflict, whether it's my fault or somebody else's fault, I look to prioritize communication and being proactive in addressing the issue. And then we were able to focus better on patient care. So yeah, my main goal is to communicate properly, and that's how I would look to approach any type of disagreement or conflict among colleagues. Thanks for asking this question. Okay. Maybe a sample answer. What do you think? Possible? Okay. Yeah, dude, that's okay. That's just send me a message. Okay, that's fine. That's fine. All right. All right. So anybody wants to take a jab at this? How to handle conflicts in the workplace? Anyone wants to give it a try? It's better to make mistakes here than, in the interview. Right? Anyone?
Okay, I'll go.
Okay, Bilal. All right, great. So, Dr. Bilal, you are here in the morning, right? And what else? What's the scenario? You are here in the morning, and you got a list of patients from your senior resident, and there are some overlapping patients that they messed up on. They messed up your census. They messed up the lists. You got some patients, and the other intern got a few patients, and you are overlapping. And both of you want to take the easier patient, right? Both of you want to take the easier patients when you realize that, oh, there's an overlap, there's a mistake. How do you go about handling this conflict in the workplace?
Yes, that's an interesting question. I believe that conflicts are like a part of life, especially working in a busy environment like a clinical setting. And most of the conflicts happen because of lack of proper communication and understanding. So I will try my best to communicate and actively listen other person to avoid the conflict. And regarding this scenario, I will first approach my colleague and see which patients he wants to cover, and because patient safety would be my first priority. So whatever patients he wants to handle, I will go with him, and I will like, if I'm doing easy patients, if he wants to do easy patients, I will go with him, and will let my attending and mentor know that he's dealing with these patients and I'm dealing with these patients, and will make the list easy for both of us.
Okay, great. Excellent answer. Anybody else wants to give it a jab, take a stab at it? Anyone? If not, we can definitely move on.